Hello and welcome to the Holistic Nurse Academy. I'm Holly Taylor. I'm a registered nurse and a board certified holistic nurse. I've been in the field for 15 years and created this podcast to bridge the gap between Eastern and Western medicine. Today I have my guest with me today is Trinity Austin. Hello.
Hello.
Welcome.
Thank you.
Oh, hold on one second. Something under my desk is attacking me. So, Trinity's a licensed massage therapist, and I am excited for this conversation because I think not licensed, but massage therapy is one of those underutilized and there's not enough credit given to massage therapists on what we can do using your services to help us heal. And we're talking about bridging the gap between Eastern and Western medicine. And so many licensed massage therapists like yourself have done a lot of you're always learning, you're always being trained in something else. So you're very skilled. Yeah, you're very skilled healers that are, in my opinion, are underutilized. But tell us a little bit about you, and we'll get into that conversation.
Yeah, well, I graduated from Utah College of Massage Therapy in 2016, so about 10 years now. I specialize more in structural integration and craniosacral, which is, if you know massage and know the modalities or styles of massage, it's a little bit funny. If you don't know, structural integration is a lot like rolfing. It's kind of the generic version of it. So it's working very deep tissues, often known for very deep pressure. And cranial sacral is known for very light touch. I like mixing the two together along with the other modalities. I'm not as trained. I am trained in some Eastern styles, but I don't work with them as much. I opened up my own practice this year in January, Three Peaks Bodyworks here in Cedar City, Utah. I specialize in helping clients understand their pain and manage their chronic pain as well, so that they don't have to just rely on doctors and coming to me every week. We work together to make a plan that's like, okay, go back out, live life again, and enjoy doing so.
Right. Well, I don't know if we had this conversation, but maybe we did, and just getting to know each other. I am certified in craniosacral therapy as well. So we could geek out on that all day long if we wanted
Absolutely.
to.
Yeah, I'm level 2 certified, so unwinding,
Yeah,
so I'm not just working just on the spine and skull. It's fantastic.
it's so amazing. It's a great therapy. So tell me about the structural integration portion of what you do. It's literally, I would say, reintegrating the body to learn how to work like it used to or how it should. Is that how you would word it? Or tell me how you would word
Kind
it.
of. The main idea of structural integration is having the body back in more perfect posture. So you're doing assessments. Are the ears in line with each other? Are the shoulders in line? Hips, knees, feet? As you know, I'm sure a lot of people see, like when you start to lift one shoulder, you see this one drop down, and my head immediately start to tilt. And so it's playing the game of, okay, usually we believe the feet do it. So like, you have the three arches of the feet. So if you have a high arch, your feet starts to splay out. So now the knees need to come in, and trying to find how to get that body in more of a perfect posture to help
Hmm.
relieve that pain and movement.
Okay. Yeah, I mean, I think that's something that is underutilized or under used in the sense that alignment can be a lot of your problem.
And
Um,
there is, take it into consideration. I've worked with clients that are like, my one femur is 2 inches shorter, and so it takes into consideration of that too.
right. Yeah, those are details that are important.
Hmm.
But I'm often amused and also befuddled by the fact that when we are assessed, we go to the doctor, we have a problem. How many times they don't actually touch the area that we're squirming about or that we're having problems in. Um, and I'm just fascinated by that because I think we can learn so much. I think they rely heavily on labs and imaging, but there's also a lot that we can learn through looking at alignment and touching the body in the area of the discomfort. Although in cranial sacral therapy, we also learn the side of the pain is not always the side of the problem.
Yep. I
But what
believe.
are your thoughts on that?
Yeah, I there is a quote by Ida Rolf. It's where pain is, dysfunction isn't, end quote, from her. And you see that a ton with structural integration. Of a lot of the times, a major one that I see a lot of is
Yeah.
that pain like right between that shoulder blade and spine, where it's just like, man, I can't get it, and there's that terrible knot right there. Usually that's coming from pec major and minor here, as you know, they're working at a desk, everything in our life is forward and rotating in, and so now trapezius and rhomboids on the back are being pulled,
Yeah.
but they're trying to do pecs work, so pulling that pectoral back gives a lot of relief. And
Mm-hmm.
it always kind of ends up creeping back if you're not careful about it. It's called a holding pattern, just because, you know, that's life. If this is your life, you're going to ease back into this because that body goes, oh, this is life. This is what normal should be. And it's like, no, let's get the shoulders down, back. That's more of your normal.
Yeah. Um, Another common ailment, since we're talking about things that are common, headaches. Um, I find palpating around and trying to find the location of, we have lots of acupressure points in our head.
Mhm.
And a lot of times I'm palpating, I'll even touch my jaw and I'll find out, oh my gosh, there's some really tender spots there, that end up being the contributing thing to my headache or something to that effect. What do you find in that regard?
I find usually when I'm talking to clients, they come in and they're like, I have had a headache for months. I can't get rid of it. It's the main three places I usually work would be the scalp, the face, and the neck. But
Mm-hmm.
sometimes it's like, oh, like your scalp's fine, the jaw is fine, neck is doing okay, and it's a weird space where it's like, what's going on? And then I go, oh, do you wear heels every day? And they're like, yeah, I do. Like even just little pumps. And I'm like, okay. And I start working their feet, and there's along with the muscle lines, there's a tissue called fascia. And I'm also trained with myofascial release to know those fascial lines. And they're amazed every time. I'm like, yeah, your headache's coming from your feet. So rather than like trying to work that jaw and that neck and being like, why is it not working? It's like, yeah, take like a little tennis ball or whatever and roll your feet out at night. And that'll help out with the headaches. And it's one of those weird things where it's like, I never know fully what's going to be. It's like, oh yeah, I've been doing it, like I said before, for a decade. And the amount of times I'm still like, I don't know why sometimes I work your glute and that headache goes away. The beautiful thing is the body's connected. And also the pain in the butt is the body's connected.
Right. Well, let's talk about fascia because that's such a big part of, craniosacral as well as the structural work you do. So let's talk about what fascia is. I think it's kind of like a new buzz word that a lot of people are kind of like, oh, I didn't know about fascia, and we're learning a lot more about it. So let's define it. Let's lay it out for what it is.
Yeah, like I know for at least when I was in school, it was kind of like it wasn't the big buzzword now. It was one of those like, oh, that's like the weird pseudoscience, whatever. So
Yeah.
I got a little bit ahead of that. So everybody being like, oh, fascia has like, if you're hydrated, it helps you move. It has the nervous system and the cardio system like running through it. It's sometimes why it's hurt and not the muscle. And I'm just kind of like, mm-hmm, known that for years.
Yeah.
Okay. And
Yeah.
it's an
It ha-
amazing tissue.
well, in nursing school, um, we talk about a major injury that can happen because of fascia, and the emergency that it is, and that you have to open up the like if you get a deep trauma to your leg, you have to open it up, and like that's like a little blurb about fascia, and that's all we get in nursing school. So all the fascia knowledge I have is from my cranial sacral therapy training. Um, but for those who are listening, it's a continuous structure. It's 3D. It's web-like. It like all of our major structures are surrounded by it. There's no beginning or end. Um, and it plays a huge part in our movement and our ability to move, to be mobile, and it responds really well to light touch. And that's not the only way you can work on fascia, but that is the craniosacral way um, to work on fascia. Let's see, what did I miss about fascia?
I read the book Anatomy Trains by Thomas Myers. That's where I have most of my basis on it.
Okay.
So it is continuous. There are some set places for it to be. You have it, we call it the superficial back line, the deep back line, the superficial front line and back line. There's the twisting line and the side lines. So it goes all throughout the body, starts at the feet, goes up to the head. I think the only thing you really miss there is it also helps compartmentalize the body. So
Mm-hmm.
if you have a condition that's a connective tissue, I usually like to explain to my clients it's what keeps your heart up here, your stomach down here, not, everything falling down to the bottom via gravity. If you want to know kind of what it looks like, I usually say, when you're eating like chicken or some meat, if you eat meat and you kind of like get that weird like second skin, that's the animal's fascia. And it's the
Yeah.
same thing that we have.
Yeah. Um, yeah, and it's a glorious thing because, like you said, you can work on the leg and affect the head. You can work on the
Mm-hmm.
shoulders, affect the legs. So um, that's what's so unique about the fascia is how interconnected it is to the entire body. And that's how we approach it in a cranial sacral way is that it's all connected. So, if you're going by the protocol, you start, with the feet and you work your way up, softening, lengthening, stretching the fascia so that you can get into the skull work,
Mm-hmm.
cranial work. But
Yeah.
that's just one aspect of cranial sacral therapy. Fascia is not the only thing we're working with or on, but that is just one aspect of it.
Yeah, and I'm not sure. I'm with my level 2 training. We do what's referred to as unwinding. Of the idea of the fascia is also like getting kind of tightened up into a little ball, and unwinding is undoing that ball, so you have that more range of motion. It
Yeah,
looks rather funny to see it, but the amount of people I'm like, that feels amazing
I know.
afterwards.
It's one of those things that you have to experience.
Hmm.
As my instructor said at one point, she's like, it's like watching paint dry. Like, so if you're just watching somebody do cranial work, it can be a little like, it doesn't look like you're doing much, but when you experience it, it's very relaxing. You can literally feel the tissue softening, relaxing, lengthening. Um, and as the practitioner, I know how it works, and I'm always excited when it does its thing.
Oh yeah.
So, fascia, what else is something that you're working on structurally?
Well, it always comes as a surprise for a lot of people as I work actually quite a lot with the cardiovascular system. There's also the nervous system as well. I know kind of like, soothing your nervous system is kind of also a thing that's going on right now, and massage is really great for that. And there's also a lot of discussions, at least in the massage world, between like, there's always been kind of a fight of whether deep pressure is better for you or light pressure is better for you. I
Right.
have the weird controversial take of it depends. If you're a
Okay.
client that's coming in and you expect it, like it has to hurt a little, it has to hurt in order to help, I'm going to be like, all right, a good exercise kind of hurt, like, okay, I'm getting something done is going to be more beneficial to you than more of that light, more traditionally seen as a Swedish touch. But there are some people who are like, I'm so scared it's going to hurt. And it's like, well, then that little bit of pain isn't going to help you because now you're scared and you're going to clamp down. And so it's like,
Yeah.
for me, it depends on you, depends on the whole situation. I have had just as much benefit from a light, easy touch as I have from like deep, really, a lot of people say mean pressure. So it's like that
Yeah.
for me depends. The major thing is with it does calm the nervous system. You do have to be aware of some cardiovascular situations, but I think they've been doing studies that like it can help with blood pressure, either if it's too low, kind of elevate a little bit, if it's too high, lowered a little bit. You just have to be careful of some things, with with high or low blood pressure, you might be dizzy, so like, don't need to fall over when you sit back up. I
Yeah.
always try to warn my clients about it, like, hey, might be a little dizzy. Take your time. Don't need to undo all of the hard work we just did.
Integrate.
Yep.
Um, so I have a friend who's I have lots of friends who are massage therapists, but we were talking about different benefits. You're talking about cardiovascular. She said she has a friend who's been monitoring her child's blood sugar before and after being worked on, and that
Mhm.
it's affecting blood sugar in a positive way, and the fact that it's lowering his blood sugar. Have you heard anything like that before?
It,
Not
it on, so I'm hypoglycemic, so I have the opposite problem of a diabetic. So every time I get a massage, I am like, okay, eat, slightly break open a candy bar because it can help as well. I have a lot of diabetic clients as well. I think it depends on the person. Like it doesn't help my sugars at all. Like it does
okay.
not it's not as effective. For me it's
Okay.
more diet and routine for that. For some
Okay.
of my clients with diabetes, it like type 1, they haven't seen much of a difference. But type 2 kind of depending, if they're also taking care of themselves and having a diet, they have noticed it stabilizes a lot more. They're not seeing it as high of spikes as time goes on.
Yeah.
But as far as blood sugar, I'm like, I always have candy just in case because I've had a few of my type 2 diabetes come in and their blood sugar just, for some reason, they're just tanked. And I'm like,
Yes.
candy, have some sugars. Please don't pass out. And so it's
Yeah.
just like, I've seen it, it's just individual person to person, as everything like with chronic conditions like diabetes is.
Sure. I just thought that was fascinating. I'd never heard that before. So that was like again, what I kind of want to do as we're chatting, because I think there's different levels of what people have experienced with massage. There's the Swedish, there's the spa, the spa experience. I'm just going self care, relaxing.
Hmm.
And, I would say there's a lot of people who find a barrier with massage in the sense that, okay, I have to fully undress and just get, like, some people that's no problem, and for some people that's very uncomfortable, or they don't know what to expect. And so it's just getting comfortable with that dynamic of, and then, once you really embrace it, you're like, okay, what's your specialty and what can you do for me? Because in my opinion, we're just underutilizing what it can do for you and all the different talented, skilled people out there. But that being said, what a lot of people like about cranial, or at least in the people I work on, because I don't do massage because I'm not a massage therapist, um, is they like that they don't have to undress. So it's a good alternative to people who have that,
Okay.
I guess, barrier.
Hmm.
What are your thoughts?
Sorry, somebody has
I,
to come in and check on me.
what's his
My
name?
biggest, this is Tilly.
Oh, hi, Tilly.
You're, yeah,
So
yeah.
cute.
Sorry.
Nothing you.
She's
No,
got to
you're
make
good.
sure mom's fine.
Yeah.
And I found that a lot, especially being like in Utah. Being
Hmm.
in southern Utah, a lot of people are LDS and also have the garment. I understand because I'm the same way. And
Yeah.
so it's like, oh, I can't take that off. Like there's specific times to take that off. I'm like, it's fine. The major
Yeah.
thing I usually say is I've adapted my massage. I can give a good Swedish relaxation massage. I can do cranial sacral. I can even do structural integration, like at least the thoughts and the techniques, some of the techniques with it. I usually say the main difference is when you're coming to see me for it is, are you wanting that smooth glide motion that you see all the time? In that case, I can't really do that with clothing. But if you're okay
Hmm.
with more stretching and pulling, for those stretches and more of that kind of compression and more of a sports style massage, then like I personally don't care. The most I
Yeah.
care about is you don't have a jacket on and you take your shoes off. I don't know where your
Yep.
shoes have been. I work on too many farmers. I don't want to think about it. About where those shoes have been. It's like I want
Right.
you, if you are relaxed and feel comfortable, then that's going to be a lot more beneficial than me being like, okay, I need you to be completely undressed. So
Yeah.
I've just learned how to adapt to work with clothing as well, just because it's
Yeah.
like, because I understand my first ever massage was when we're like, okay, class, we're gonna learn draping today. And I went, what? Excuse me, what? And set a draping right here on the chest. Accidentally, the sheet went down here, and I just had to be like, nope. And so I'm like, I understand why it can be so uncomfortable and scary. And so I'm just like,
Yeah.
don't worry about it. Because I
Yeah.
also have a few clients, I work on some veterans that they're like, well, I have really horrible scarring, or I'm embarrassed of my body. And I'm like,
Yeah.
hey, take your shoes off, you can leave socks on. We don't have to worry about that. And it helps
Yeah.
them feel more comfortable and to be able to be more open. And like I say, they're not afraid, and so they're not closing in. And I'm like, I have to fight that on top of it. Okay.
Yeah, it's like don't miss out on the benefit because of that. Like they're a good therapist will work with you on that.
Oh,
So,
yeah.
or you can do craniosacral therapy, which does not require you to
Yeah,
undress at all.
craniosacral does that. Sports massage is traditionally done with clothing on. At least my training was. You're doing more stretches, so like, don't show up in like a dress. But
Yeah, yeah, yeah.
yeah, or
Something
even just
comfortable.
or doing like an event like a chair massage. You don't get undressed with that. So like if you want to try something like that, look for those kind of styles and situations.
I just feel bad because I'm like, you don't know what you're missing out on when when you're using that as a barrier. So don't miss out. And so some of our audience are, just listening because they want to hear about the options that are out there and learning more about these things. And some of our audience or listeners are nurses themselves. So part of this is about educating what the options are, right? How can we help people by knowing the options that are out there? So that's another angle that we're coming from is as an option giver and a nurse, a holistic nurse, or like a holistic nurse is an option giver. So what I want to see, and I'm just curious what your experience has been. Do you have anybody that you work with in tandem, or do you ever get referrals from the healthcare world, or is it usually self-discovered?
Well, where I am starting kind of my business this year, I'm trying to work on building relationships. I get a lot of, work with other massage therapists where a lot of them are like, you have a very weird, very nice thought process through stuff. And I have the same thing where I'm like, I don't do that particular, like, I don't do your resort relaxation style as well. I can, but you'd be happier with somebody else.
Yeah.
I work with a couple of chiropractors. We refer back and forth, as well as working with physical therapists, sports medicine doctors. I'm trying to talk to primary care physicians as well. So it's kind of like I'm reaching out to talk to other more medical forms because that's where I want to be. I know other massage therapists have, like, if they're doing more your resort relaxation styles, they also reach out to hotels. They'll reach out to other, like, destination things as well. And just kind of
Yeah.
really anybody you can kind of work into being able to be with massage. I just tend to go more with the medical because
Yeah.
that's where I shine and I'm happy.
Yeah. So, who's like do you mainly focus on pain management? Would you
So
say?
mine's mainly rehabilitation and pain management. A lot of my clients are the ones that are coming in like, hey, I had surgery 3 weeks ago. Hey, I have fibromyalgia. I have arthritis, both rheumatoid and osteo, just kind of your normal arthritis. And like those kind of things, or like, I've had this shoulder pain and doctors like scans are normal, labs are normal, but it's in pain and I don't know why. That's
Yeah.
usually what I see in my clinic.
And what kind of tell us some of your good success stories? What are some things
Well,
that you've
I'm actually one of my own success stories. So my left arm, when I was about 10 years old, I was getting off of a trampoline and I broke it. I had I had a second elbow here, and I had to have surgery to put plates in to make sure my bones were back in place. And being 10 years old, they didn't want my arms to be, this kind of length, so they took the plates back out. And in doing so, they realized the scar tissue was actually building up on the nerve. specifically the median nerve. So they're like, she's a left-handed 11-year-old girl. We're going to try scraping off that scar tissue, even if we nick that nerve, to try to not let her be crippled.
Mm-hmm.
And they did nick it. They also found it on the ulnar nerve too. So this entire arm, from about my elbow down, is completely numb. I could still move it, but I had that fear of moving it. And every time I would move it would like kind of crunch. Had scars from my elbow clear up to my wrist, and in massage school we learned a little bit how to help with the scar tissue. The scar is now only about this long. It was also key knotting, so jumping up and down the skin, and it's smooth. I I no longer like to this motion was really scary for me, but now I just don't worry about it. I can actually move it and use it. And I used to also suffer from migraines. It was actually from my calves. I used to run and helped relax that. Oh, so it was like name one. I have so many.
No, take your time. We've got time. So if you got a few, we got time.
So I've also working on a client. She's once again she was one of those. That's like I've been going to the doctor. I have had headaches for years. They're like in the morning I don't have them, and then I go to work and I start to have them kind of it starts to set in the afternoon. I come home, I start to unwind, and all of a sudden it turns into a horrible migraine until I go to sleep. We've done MRI scans because like the first thing they were worried about is like, is there a tumor? Is there something going on? And she's like, MRI, X-ray, CAT scan, everything was fine. My blood work was fine. No medication was touching it. And she's like, I happened to talk to another one of your clients. They're like, yeah, she beat the crap out of my shoulder, but I can move my shoulder. And so it's like, maybe she can help with your headache. And first session, I'm starting to work, neck's usually one of my first places, especially if you get a headache that feels like a rubber band that's just
Mm-hmm.
pushing. Because I'm like, okay, it's probably there. And I'm like, no, it's not there. And she'd seen other massage therapists as well. And I was like, okay, weird. And then I realized her scalp was really tight. And I went, what kind of hairdo do you wear? And she kind of wore that really high, really tight ponytail. And the moment I pulled that ponytail out, she's like, yep, that's the headache I get at night. And I go, okay, quick scalp massage and a little bit of facial massage. And she's like, it's gone. And I went, yeah, this sounds really terrible. One quick motion. Don't have it as high. Lower your ponytail down a little bit. And rather than the 4 times, just wrap it 3 times. And she's not had a headache since. And she's like, well, now I have shoulder pain. And I'm like, yeah, we'll start doing that instead and do a little bit more of the pain chasing is what we call it. Of like, well, you fixed one squeaky wheel. Now we'll fix a different squeaky wheel.
Right?
And like that's something I hear all of the time with a lot of my chronic pain clients. They're like, I didn't believe it at first. Like, yeah, it felt nice for a day or two, and then it would come back. But then they started noticing their flares when they would have a flare up. They were not as intense. Rather than being at an 11 or a 15 in pain, they were like, I'm at a 10 or an 8, which is manageable. I still might be laying in bed, but I'm not crying in bed. And instead of lasting 7 days, it was starting to last 5 or sometimes even 3 days. And they're like, oh, that's where massage is coming in. Is not so much on a make it, fix it, cure it. And right now it's as we go on, it's going to help me manage and calm it down. They also
Mm.
noticed their mental health on it was not like, what did I do to trigger it? They started thinking, okay, what have I been doing the last few days? Or is this part of a cycle that sometimes usually happens? Like a lot of flares happen in the spring and the fall. Is that what's going on? And rather than being like, it's me, I'm a terrible person, I did this to myself, it's, is there an external thing? What's going on? How can I help? What did Trinity recommend that when I have a flare that can help? Also bringing in some stuff with the doctor and being able to speak with the doctor about it. And that's where I love to be, is having my clients have that moment of just click and be like, oh, I can manage this. I don't have to live with it. We can help manage it and make it smaller. And that's my absolute love. And
That's
that's
so great.
so much of what I have.
Yeah. I mean, and it's such a, like, I mean, really, non-invasive, great solution compared to having to take medication or having to have a surgery or having to, live in chronic pain. Um,
Yeah, I always
yeah,
joke. I always joke, well, massage is so much nicer. I'm a little bit cheaper, and my recovery time is infinitely easier to deal with. It's shorter and it's not as painful as like a surgery. And everybody's like,
right.
yeah, the massage itself might not be as comfortable, especially if I'm working like psoas and your
Yeah,
abdominals. I'll work a lot of diaphragm as well. They're like, that's not comfy while you're working it, but once you're done, it feels so much better. I might be a
right,
little sore the next day, but I'll take that sore versus, second day after, like a day after surgery.
right. 100%. I love that so much. I think I would like to see it be more of a referral source in pain management. When we're looking at the whole picture, have you tried massage? And also having names like yourself for people who are looking for like a true, they're like we were talking about the different kinds of massages, like one that's actually going to structurally help. So I love that. Um, any other success stories you want to share, or those are the big ones?
Not that I can think of at the moment. I say
Did
I'm
you
kind
work
of in. Sorry.
Did you work on yourself? Is that when you said I'm one of my own success stories? You just would work on
Yeah,
your
I just
own.
like I can't work like my back and my hips very well, but like I have also big injuries in this left foot. I can reach that pretty easy. I can reach my arms. I do a lot of it for my self care as well because like I'm working like this a lot of the day, so I also get a lot of shoulder pain. And if I'm not having my own personal body mechanics good, you can get a little back pain. You can mess yourself up if you don't have good body mechanics and a good awareness of your body during massage. That's why they say usually a massage therapist only lasts in the industry I think they said 3 to 7 years at this point. Is you're not worried about your body mechanics, and so
Yeah,
that starts to really mess yourself up. So it's like I've got to make sure I exercise really well. I get massages myself. I'm taking care of my own body, and part of that is where I can reach is where I can put a cup on my chest as I'm, on the pecs right here as I work my forearms
yeah.
themselves and my legs.
It's definitely in my routine for wellness and making sure my body's moving well. I have like a handful of different massage therapists I see for different reasons. And like I have a friend who does Thai massage, and you know that's really good. I feel like I get a good stretch and workout while I'm getting a massage. But I have you know lots of different. I have someone who does lots really good sound therapy, and she goes when she does it in her treatment. She goes like her massages are very slow and methodical,
Mhm.
um, and you know it just kind of. So one of the things I want that as you were talking, I was remembering is a little fun fact for everyone who doesn't know this already is any kind of therapeutic touch, if you hold the intention of working on someone and being therapeutic, 20-second touch or longer releases oxytocin. You're going to get those happy hormones from, especially one of the things that seems to be a theme is like if you're not with a partner, if you're single, don't have a lot of touch in your life, and you can tolerate it, this is a really good fulfilling a need that we all have, which is that
Mhm.
prolonged therapeutic touch.
Yeah.
You right?
Even if it is through like clothing or even just sheets, yeah, you can usually tell when a client's actually relaxed. It's one thing like you never see in like the pretty videos and the promotional things is usually I like to start mine as like, I undrape the back and I start putting a nice, you know, like I start running my elbow down that back is just and you just watch the body like kind of deflate and then like melt into the table. And that's when I'm like, we're having a great session today. and being intentional and knowing, I'm paying attention. So it's like, oh, right there's a little sore, back up a little bit. That comes with, the years of understanding and just watching them just relax and hearing that stomach gurgle and being like,
Yeah.
it's just
So
all of those relaxing,
yeah,
notifications to me.
yeah. So let's talk about the signs that you see when you're relaxing, right? You see the deep sigh.
Deep sigh is a very common one. One thing I do sometimes have to remind my clients is, especially if I'm working that low back or the hips, um, I can tell when you're holding back gas, and it's okay. I've learned very quickly to leave my face away from it. And if it's
Yeah,
really bad, we just go grab some aromatherapy and you're fine.
it's fun.
And it's like it's the intention of not just are your muscles and that fascia relaxing, it's also all of your internal organs are relaxing. So that
Yeah,
parasympathetic system, that rest and digest, is starting to activate, which is a wonderful thing.
yeah.
Like
Well,
those are the
and
main ones I see.
yeah, you have like the gurgling stomach.
Hmm.
People get conscious about it, but that's actually a good sign that
Hmm.
things are real.
Same thing as passing gas. It's everything's relaxing. Sometimes I'll also see with some of my clients, it depends on the client. Sometimes when I start, seeing those things, either they will start talking, and it can be something like big and deep, of like an emotional thing they're traveling through, or it could just be like superficial, and they're just
Mhm.
excited. They're like, I have a vacation next week, or my child or animal did this fun thing, and they just start talking about happy and exciting things in their lives. Or if
Mhm.
I have a client that's coming in and they're like, I don't want to say high strung, but they're stressed. They have a lot to think about, and they're just kind of processing, talking to me, and they start to quiet down.
Yeah.
There's also
Yeah.
another one. Also another one is, oh, hey, you twitched. You okay? Oh yeah, you're fine. Okay. Just that snore, and just that
Yeah.
falling asleep twitching. It's just like, was that a hurt itch, like a hurt twitch, or a I'm relaxing twitch? So
Yeah.
sometimes I double check, but if I hear a snore, I'm like, I'm not gonna worry about
No, it's a compliment. By all
it.
means, snore away.
Yeah, I'm like, if you're snoring, I'm like, I'm doing great. Good job, me.
Um, so with as nurses, we have and anyone who's in a home where, people are comfortable working on each other or touch. What are some like good techniques, hands or feet or shoulder, neck? Do you have any like quick tips on ways to, I have some ideas, but I want to know from your perspective on how to relax the body, how to, grabbing feet at the right pressure is always kind of one of those interesting things. What are your, what do you know, or what can you teach us?
Um, well, one of the big things I love to do is if my clients are like, I don't know how to relax, I can't relax on the table, is it's like, okay, we're gonna do some meditation. And they're like, I
Mm,
can't get my mind to go blank. And I was like, we're not doing that kind of meditation. But
yeah.
taking like, the big deep breaths and going through and, different senses. What are some stuff like what does this, do you smell anything in the room? Do you like, and is it causing you to have some taste? What are you listening to the song? Have a lot of different covers and video game music, like calming video game music for my music room. And it's like, do you recognize the song? Can you follow along with the melody? And a lot of times, like that's when they start thinking that. I'm like, okay, and now let's go into what we're feeling. Can you feel the sheets on your skin? Can you feel, you know, what's on you first, and then that breath? What does it feel like to have that up and down? And then it's like, okay, you relaxed enough. What are you feeling? What feels like it's tensing a little bit? What feels a little bit too loose? And you go through your body, and that helps them. Now it's not just don't think of anything. It's active paying attention to yourself. Um, I also have it to where my room done a way too much, baseline, very superficial psychology of stuff. My room, every time you walk in, will be the exact same thing. So you know exactly what you're walking into. The cups are aligned the same way, the table's done the same way, everything's the same.
Yeah.
And that's, you know, you're not having to think what's coming, you know exactly what's there. The music, a lot of the music I listen to is focused not on just relaxation, but a lot of your video game music is made to help you focus. And so doing stuff like that. Other than that, it's mostly just, you know, to relax doing that. If you're wanting to help I do more, we call them repatterning exercises. Small little things you can do during your exercise or during your day to help you get more away from those holding patterns to get more in that posture. And a very easy one, a lot of people do it at a desk, is you're sitting up and down straight. You like the best you can think of is straight. You notice you're doing this at work. You know, you're sitting at the desk. Just kind of sit up what you can. Thumbs up, take them out, and then just push it back. And you can see my shoulders are immediately pushing back. And you'll want to move your head back because like sitting like this feels funny.
Mm-hmm.
Running a tennis ball through like the arch of your feet, often, especially if you get low back pain and foot pain, that's really helpful.
Yeah.
That's one of those. I'm like, usually it's a little bit more of like that's why it's so personal. So I'm like, I work with people, but like those are good in general things to do.
Right.
Good hand stretches I usually do is just, you know, take your fingers, push them back, take your fingers, pull them. Sometimes interlocking them and doing this also just feels great.
Yeah.
It's just kind of like
Well,
they're basic and easy. It's so like
yeah.
you can remember to do them at home.
Right, right. Well, that's what we need. We need easy and accessible,
Hmm.
especially, you know, like the at-home stuff is good. And then for nurses listening, don't ever underestimate. Like, it took me a minute to get used to this, but I have like a playlist on my phone, and if I needed a calm environment, you know, I would dim the lights, close the blinds, turn on my
Hmm.
music, hold their feet, rub their feet, you know, any kind of therapeutic light touch, bring your presence, like never underestimate the power of that.
Hmm.
Um, and what we're doing, like you were saying, a safe environment is like sometimes 90% of the work, right? Just
Hmm.
like the environment set up and just having the right environment can do so much for people and their nervous system. I
Yeah,
mean,
especially if
I
you're sorry.
okay.
So especially if you're used to like a bunch of chaos, be it, you
Right.
know, you have little humans running around your house
Right.
or just a whole bunch of stuff, having a space where it's like, this is the same, it is clean. I can just take a minute, take a deep breath, and you know, you can recenter to yourself and then go back out to the chaos. It helps a ton with that nervous system.
Hmm. Well, to that point, I had a client the other, you know, a little bit ago. She came in, and I don't think she realized it at the time, but I kept looking at her like, "Is she okay?" Because she was just like her eyes were just like wide open.
Hmm.
She wasn't upset or anything like that, but it could just like her eyes just looked so big, and I was like, "Is everything? Oh yeah, everything's fine." And but she was talking about some things that were also stressful, so I was like, okay, I could see that there was a disconnect between what I was observing and that she realized I don't think she realized how activated she was.
Hmm.
And so I just, you know, focused on helping her feel grounded and centered and like the nervous system reset in the session. And we were at least halfway through before like I watched things go.
And start
Yeah.
unwinding.
Yeah.
Yeah.
And then by the end, she's like, well, thank you so much for like just slowing everything down.
Hmm.
And that's, you know, she was able to finally close her eyes, kind of get into that like, you know, that peaceful half awake, half asleep state. But it took some time, and I think that's very normal. I think
Hmm.
until we get in an environment where somebody's holding that space, sometimes we don't even realize that that's
Yeah.
what we're experiencing. So,
Yeah. No, I see that a lot, especially if a lot of my clients also have like anxiety of different forms, like generalized anxiety, anxieties over socialization, anxieties of a whole bunch. I'm just like, do your best. Like telling them those people like, oh, just relax isn't going to do anything. But usually techniques I often use if I'm like, okay, I need my client to relax, but I go, hey, relax. They're just gonna be like, yep, nope, definitely relax, definitely relax. It's like, oh, no, that was the opposite of what I needed. Is just gentle jostling. So like if you're working their hand or their arm, is just gentle, just moving it just a little bit. That just immediately signals the body to just stop.
Okay.
Sometimes you have to do it for a minute, and you're just kind of like, come on, come on, there we go. Or sometimes what I'll do is, hey, I need you to wiggle your, like I'm working up in their shoulders. Like pecs tend to be so tender, as well as like working the abdominals. I'm either like, okay, I need you to wiggle your toes, move your feet in the best way you can, because now their brain's not focusing where I'm working, it's focusing on moving those feet. Or I give them a stress ball. I'm like, there's one rule with this. You can't throw it at me. And they're like, why? And then I'm like, because that's rude. It hurts. And they can just sit there and I'm like, okay, kind of like when you're donating blood or, just kind of pump it. Try to pump it to the beat of the music. And now they're focusing on the music and the ball in their hand. And it just kind of distracts the brain from somewhere else. That's the best I have found for relaxation. But again, I'm usually like, elbow deep and shoulder, or I'm like, yeah, sorry, I'm up in your armpit. That's not gonna feel great. Here you go. Distractions. Or sometimes it's, if they don't want to wiggle their feet, I'm like, okay, what's your favorite dinosaur and why? And I'm like, that's a really weird question. I'm like, yeah, well, think about it for a minute. And again, it just distracts that brain. They're not worried about what's burning into their armpit as I'm working their pec minor. They're more going, what, do I have a favorite dinosaur? Have I ever thought about this question?
Right.
Kind of situation. That's the best I can do. That's what I usually have my clients do, like when they're on the table for relaxation.
Yeah.
Is like, it's just, distract that brain, make them think of something completely different. We're not worried about it. And sometimes it's just, I have to stay there for a minute. Kind of like the idea of, technically you feel the clothes that are on you, but after a while it goes away.
Right.
It's like, so if I'm just sitting there, eventually the body will be like, okay, this is normal now, and just kind of like start to ignore it. And sometimes I'll pull cupping in with that, but I'm not sure. That's a little different in different states. And I know in the state of Utah, you don't have to be licensed to be a cupper, like to do cupping, but like, me personally, I'm like, be licensed of some form of knowing anatomy so you don't hurt somebody with cupping, so you're not doing it like on the abdominal region or at the front of the neck. Those are not places that you want to do it without training, but like.
And is the goal to increase blood flow? Is that the main goal of cupping?
Sometimes I use it for that. So I'm trained in neuromuscular cupping. So it's a little bit of blood flow, but it also, rather than that push that I usually do, it gives it that up and lifting, so that zero gravity space. So it's a little bit different and that little bit more movement. That's what I usually use cupping for. You can also, if you're just kind of sitting there, so I use the silicone cups. So it's really easy for me to like, okay, you push it down, suction, and it sticks. If you just like do very light suction and kind of like pin, we call it the taco grip. You just kind of just like put it on, take it off, put it on, take it off, put it on, take it off. So it's kind of going, and you just like kind of like gentle taps. Kind of this equation that is getting the blood, that, especially doing it like right here on the side of the ribs. Where it tends to be tender and ticklish. You do that for a little bit, and the body gets used to that feeling of cupping, and then it can just ignore it.
Okay. Yeah, I think cupping's been helpful for me, and it's also very fascinating. I think part of the conversation we're having too in this in our podcast is nurses, explore your scope of practice and what you can do in your state under your license. Because you have a license to touch. That's why craniosacral therapy was a path for me, because I can use my license to touch to be a craniosacral therapist in our state. And I think in most areas that's true. I don't know of any area that is limited by that. But that's been a very happy marriage for me. And that's kind of what we're trying to do, is help nurses look outside the box of, maybe you are getting to that point where you're tired and needing something different. Part of what we're educating is that there's other options out there.
Mhm.
You know, it's even a good segue into becoming a licensed massage therapist. And um, if that resonates, or some people don't want to go back to school, so then what can we do within our license? Again, in our state, Thai massage is something you can do with a license to touch. You don't have to have be a licensed massage therapist. So a registered nurse with the training of Thai massage can do that. So
Yeah. Yeah, because I know
go.
also the last few years Utah's changed the rules. You don't have to be a licensed massage therapist. You can also now we depending on the therapist, you can also be an apprentice. So
Yep.
rather than going to a school and having to go to classes, you can learn from an actual massage therapist.
Yep.
I'm not sure how that is with nursing, but it's like that's an avenue if you want to look into that. Like I know me personally, I'm like I am not in a position to do that. But I know quite a few of them here in Cedar are like, oh yeah, no, we take apprentices to teach them what we do.
Yep.
And it's like,
Yeah, and I think that's a great way to do it, and it's a great avenue um,
yeah,
for
because
people
like
who.
yeah, because like with the Utah College of Massage Therapy, they had two courses. One was a 6.5 months, and one was a year and a half. Each one of those, the main difference between the two is, are you taking one 2.5 hour class every evening, or with my 6.5 months, I did two and a half classes every day for 6 months. And then also
Mhm.
doing clinical where, we went out and you were working on bodies, the volunteers that that most people know about massage school. And it was rough, especially the days where you're like, here's a 2.5 hour lecture on anatomy. Then you go to lunch and come back, here's a 2.5 hour lecture on pathology. And you're just like, oh, oh, I'm drinking from a fire hose. Oh.
That
And
is
for
how
me,
nursing works.
yeah, and for me it worked. I was 19, 19 turning 20, so my
Yeah,
brain could handle it, but I'm like, if I were to do it now, I'd be like, my brain,
I
I'm
know.
so tired.
Seriously. So true. Um, well, I believe that, kind of as we're wrapping up, we're either a patient or we're a provider or we're both. And one of the things I'm interested in and just people's general feeling right now, there's a lot of trust that's been lost in the system. And I'm part of being holistic, I think, is about rebuilding that trust and asking what is the repair mechanism? How do we regain trust in the system? Do you have any thoughts on that? Either as the patient or as the provider or both?
Yeah, I've seen a lot, like I say, a lot of my clients are coming in of they feel like either the medical system or like their personal doctor or something in the more medical world is either they're falling through the cracks or it's like, sorry, there's nothing we can do. We can't fix it, so sorry, you're just gonna have to deal with it. And they
Yeah.
come see me and I'm like, I had the same situation. I have endometriosis and PCOS, and it took me 13 years from 16 until about 23 to even have a doctor go, "Oh, hey, maybe, you being curled up in pain every month, that's not normal. Maybe we should get that checked. And you have a family history of these situations. Girl, you need to get checked." And then even then they're like, well, you have it. Cool, what can we do? Chemotherapy. And I'm like, oh, how's that gonna feel? What's that gonna do to me long term? We don't know. It's best we got. And I was like, oh, cool. But a little bit of massage helped with that. I also found I had to go find a specialist in endometriosis. And, he was like, okay, we have some better stuff. And they've helped me out now. But I'm usually a joke. I'm like the specialist. They come see me and they're like, they tell me I have fibromyalgia, I have Lyme disease, I have rheumatoid arthritis, and they're doing everything they can, but they're like, nothing more we can do. And I'm like, let's see what we can do. Because sometimes the triggers that you're having is your daily motions. Sometimes it's you just need to relax that nervous system. You don't need me to beat the crap out of you. You just need a little bit firmer pressure for that body to be like, I'm safe, and to
Yeah.
be able to have that time to unwind. And it's different person to person. And so, that building of trust is, I don't just go like, okay, well, like jump you into a 60-minute massage because it's like, that's scary. I have a 15-minute consultation. It's like, okay, come see me. You stay dressed, we're on a chair. We talk about your pain. I listen to you. I might mimic back to you and be like, okay, and how is that affecting your life? I don't have 5 minutes to work with you. I have 15, 60, 90, whatever it means. I'm not going, okay, rush you out the door. It's, we will take the time. And that's something that our current medical system, I know it frustrates a lot of doctors too, do not have. And so it's
Right.
just building up a relationship with people and being empathetic and taking the
Right.
time that a lot of people don't have time for.
Absolutely. I couldn't agree more. And if there's one big takeaway from today, it's like, don't underestimate the power of someone who is a massage therapist and has really perfected their craft and really specialized in like pain management and helping people with rheumatoid arthritis and um,
Yeah, so I bring up
fibromyalgia.
rheumatoid arthritis because those are the ones that come to my brain just very quickly.
Yeah,
There's other ones too.
yeah, yeah, for sure. Fibromyalgia, you know, chronic back pain, chronic
Mm-hmm.
headaches, my like sleep disorders and issues can be helped through what we've been talking about today. I mean, there's so much that can be helped, and like you said, it can be like amazing and life changing, or it can be a link in the chain
Mm-hmm.
that you need to complete your circle of helpers. You know, so it's not always um, you go to one person and everything gets fixed, but like this is a pin in my care management team.
Yeah, I usually like
And
to say I always like to say we are either. I'm like, I'm as a massage therapist, I'm helping the body heal itself. So that means
yeah,
I'm not helping you. We are working together for that. And if we need to, I am more than happy. I can speak jargon. I was trained in medical terminology. So if the doctor's going to be a wee bit of a jerk and be like, yeah, here's the doctor's notes, and I'm like, unfortunately, I can read your shorthand notes, and these are typed, so that's even better. I can read chicken scratch too, and and then I can also be like, here, I also write soap notes, which are doctor's notes, and I can be like, yeah, no, here, these are my notes. You can give these to the doctor, and we are now communicating as a full team. And
yeah,
the amount of clients I've had to be like, so the doctor said I had this thing, and I was like, um, first off, this like they'll say it's slightly wrong. I'm like, do you mean this? And they're like, yeah. And I'm like, okay. Or they're like, this is my MRI. And I'm like, I cannot diagnose, but I will look at this MRI because yes, I love anatomy. I've loved anatomy and kinesiology. So I'm like, yeah, I want to see how you're broken. Yeah, there it is. That's what this is. And they tell me like, and it's like it's so nice to be able to have somebody to explain to me and not make me feel stupid. And
yeah,
that's one thing too I've also noticed a bit in the medical terms, and it's just it's nice to have that option because it's like I said again, we have 60 minutes with you, and usually at minimum, to help
right.
you understand and care.
And it's worth it. It's worth the out of pocket cost to take care of your body. I don't know where I would be right now without body work and that being part of my own personal care. I don't even call it self care because it's part of my, taking care of my whole self. Um, and the work is really important, and I'm grateful that there's people like you who take the time to really become skilled outside of the initial training and keep going and keep learning. That's kind of who I am too. I'm a forever learner.
I'm a forever student.
Yeah, forever student. Um, and for those who are listening and are interested on these types of modalities and want to learn more, you can go to holisticnurseacademy.org, where we do have training in light touch massage, light touch techniques that do translate into what we do at the bedside as nurses, but also like if you have a family member who needs it, or if you need it, like you said, you can work on yourself to some degree. That's what the whole purpose of this academy is for. So, Trinity, any last thoughts or
Yeah, if
things
you're
you want?
okay with me doing my own little plug.
Absolutely.
Yeah, so if you follow Three Peaks Bodyworks, I'm on like most of your social medias, Facebook, Instagram, also on YouTube and on TikTok. I try to do like, yeah, you'll see like some promotional stuff, but every Friday I have stuff that I do. It's like, hey, here's some easy stuff that like, here's some massage techniques at home you can do for your partner and also for yourself.
I love
And
that.
I also put underneath, it's like, this is great for back pain. This is great for, yeah, this week I think it was a neck pain for a partner. And it's like, here's some great stuff to help with low back pain or hip pain. And so if you want to do that, I am that's what I went into this business for. Is originally wanted to be a doctor, found out I don't have a kidney and a firstborn child that I'm willing to give up. So I'm like, well, if I can still help people through massage, let's do that. Let's take away the mysticism of it as well.
Yeah.
It's a science. You can do it at home. You can recreate this at home. Here's how to do it.
Yeah. Awesome. I love that so much. I appreciate that you're offering tutorials and free information on your socials. So thank you for doing that.
No problem.
Yeah, thank you so much for being here today. I am talking to you. It's always fun to geek out on cranial sacral therapy with
So
a
fun.
film. Cranial sacral therapy. Hopefully, I'll have a full podcast on that one day, but it was fun to at least talk about it in part today. So,
All right.
okay, well, have a great rest of your day. And then for those of you who are listening, visit us at holisticnurseacademy.com, and we will be back next week. Thanks so much for listening. Have a great day.